there have been a lot of reports, and perhaps also to Dr. Henry, there have been a lot of reports of people whose visits with their loved ones are not being honored in long-term care, not being able to get in for their allotted number of hours, of time, etc. Why haven't we heard anything about long-term care restrictions being lifted under stage 3, and why are loved ones not able to go see their family and their friends in long-term care homes now that we're having large gatherings and limited restrictions, if any, in businesses in the province?
Well, first of all, I have family in long-term care, and we do visit. So, and it's because of significant changes that were made March 25th, which were to expand visitation in long-term care. At a moment, you'll recall, when we were introducing the circuit breaker changes to try and reduce community transmission. And the impact, of course, on long-term care of vaccination has been profound. If you look at 49 outbreaks on January 15th, and the vaccination of both workers and of residents in long-term care had an almost immediate, within weeks, reduction in that, and that led to a lower level of mortality in the third wave. With respect to visitation in long-term care, there are more changes that are needed and will be made. And like I say, they're not coincident with this multi-step process we put in place in terms of the easing of restrictions broadly. But they haven't been all along. We've acted in long-term care to massively invest in staff, and we raised care standards significantly. That's happened. To support long-term care efforts, the investment in infection control, the single site order, which led to wage leveling and an improvement in the working conditions of long-term care workers, and all of the other measures that have been put in place. And still, there have been, of course, enormous challenges in long-term care, in spite of what I think has been, by national standards, a very strong response by public health. So with respect to visitations, you should expect to see even more steps in the coming days, and those are being reviewed right now. But they're not in sync. Just as we lessen or we increase visitation, just as we are introducing new restrictions, we're moving those. We'll be putting those into place, working with long-term care residents, their families, and long-term care homes, and you should expect those very soon.